Hello, I'm Councillor Dr Erica Lewis and I'm the leader of Lancaster City Council. As of 001 Saturday 17th October, the Lancaster district moved into Tier 3, or the very high category of COVID restrictions. This followed a long week of difficult negotiations between Lancashire leaders and the government. Throughout our negotiations, the question of how we save lives and save livelihoods has been central. We know that COVID is not the only risk to health, that treatment delayed, isolation, job loss, financial stress, and just the strain of living through the pandemic can all be fatal in themselves. The City Council will do all we can to support you, as we have done throughout the pandemic. But the new business closures and regulatory changes won't alone reduce transmission enough to get COVID under control unless every one of us plays our part. Our district needs your help. One of the key sites for transmission is within households. What we are seeing in the data is that one person picks up the infection outside the home, then they bring it home and everyone in the same household gets sick. This is entirely usual. You share a bathroom, a kitchen, a bedroom or a couch, the infection will spread. But there are things we can all do to reduce the risk of bringing the infection into our homes. It's been said many times, but frequent hand washing, particularly when going out or coming home, giving space, 2 metres or more, and wearing a face mask all help to reduce transmission. Tier 3 means you're not allowed to socialise with anybody you do not live with or have a support bubble with in any indoor setting or in any private garden. We know that people don't like this rule, and I completely understand that it is hard to be separated from friends and family, and for some people, desperately hard. This is why the bubbles are an important policy. They should mean that no one is cut off. If you have friends or neighbours who live alone, maybe check whether they've formed a bubble with another household. And you can socialise in groups of no more than 6, including children, in certain outdoor areas like parks, beaches, the countryside, public gardens, outdoor sports facilities or playgrounds. And our district is blessed with these spaces. Remember though, while being in the outdoors can be safer than being in the indoors, the risk increases the closer you get to each other and the more time you spend together. So again, hands, face, space are once again your best defence. If we all look after each other, no one should have to be alone. We know the restrictions on socialising are hard, but with so many people being sick without symptoms, we need to understand that every contact we make may be the contact where we get infected or we pass the infection on to other people. And if this is a cross-household contact, the infection travels to a new household and the cycle starts again. We've fought hard over the last week for extra resources to get this disease under control and to support our residents, jobs and businesses. The agreement we made with government this week will bring extra resources to local test, trace and isolate programs, which is fundamental to reducing transmission, to support safe operating advice and enforcement for local businesses, to our resident support programs and our economic support programs. Lancaster City Council's Community Hub remains open 7 days a week, and we would encourage any resident who needs help to call 01524 58 2000. Businesses who have questions about safe operations should contact environmental health at lancaster.gov.uk, and businesses who need advice or further support should contact LCC Business at lancaster.gov.uk. Thank you and stay safe.